helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm Katie Wilson. Today we've got Dr. Shane Cook from Boone Memorial Hospital. Thanks for being here.
Thank you very much for having me.
Yeah, we always love having doctors and getting to learn from your expertise. And we're talking about something that obviously affects everyone. We're in the summertime. We all love getting out, playing in the sun, but when we get out and expose our skin to the sun, that can also bring some danger. So
Exactly.
let's talk about how we can protect ourselves.
Okay, so as a dermatologist, I diagnose and treat skin cancers and many diseases that are caused by or worsened by the sun. So sun protection is extremely important to me and my patients. One of the main things is the sun is worse from 10 a.m. to 4 p.m. So if we can, we want to avoid being out during those hours.
Okay.
If you can't avoid being out, I know you're going to be out, then I recommend a sunscreen. Physical blocker sunscreens are the best, and a physical blocker, that's one with titanium dioxide or zinc oxide in it.
Okay.
And you can look at that on the back of the label.
Okay.
The other things with the sunscreen, you want to make sure so it's not recommended in children that are less than 6 months old. So then we want to use other things. If you hate putting on sunscreen like myself, what I use is sun protective clothing, hats, and sunglasses.
Okay.
There are many companies that make sun protective clothing, and those will have UPF in them. Companies like Columbia or Cooley-Bar are some examples. And if you don't want to change your wardrobe, one of the things you can do is there's this thing called RIT Sun Guard. It's a laundry detergent, and that's RIT Sun Guard, that makes your existing clothes sun protective.
That is so cool. I had no idea.
It's nice to have. Yes.
Okay, good to know. And I think that I heard you mention that some of those sunscreens that you were suggesting, you cannot, did you say, use for babies that are 6 months or older?
That's correct. They're not recommended for babies that are 6 months or less.
Okay,
Yeah.
so for those babies, then you would go the route of more putting on protective clothing?
That's correct.
Okay.
Clothing or any kind of visor or umbrella that would shield them from the sun.
Okay, and now this is a topic that I gotta be honest, I didn't even think about until I started getting into college, and that's kind of preserving your skin. A lot of the times us women, we want to be tan, and then as we get older we start to realize maybe this isn't the best idea long term.
That's right, and that's one of the most popular questions I get as a dermatologist is what can I do to make my skin more youthful?
Yeah.
There are really three things. One is sunscreen, or sun protection. Two is a good topical skincare regimen, and three is cosmetic procedures.
Okay.
The sunscreen is important because the sun damages the skin. I think the best example is the photograph of the truck driver who had been driving for 28 years. They showed the picture on the news back in 2012. The left side of his face, the side that was exposed by the sun, looked 40 years older than the right side of his face.
Wow.
So sun protection is important. The next thing is a good topical skincare regimen, and there's really two components to that. One is a general moisturizer in the morning, and two is going to be a topical retinoid at night.
Okay.
The moisturizer is going to hydrate your face, and many of those have sunscreen in them as well. So
Right.
you do that in the morning. The topical retinoids we use almost every day in dermatology. Topical retinoids are anti-inflammatory, they're anti-aging, they're antioxidants, and they work to kind of normalize how the skin grows, and they work to sort of reverse some of the damage that the sun has caused. That damage could eventually lead to skin cancer, so it's important to have that on there.
Okay.
The one I recommend is Differin or Adapalene. It used to be a $250 prescription, now it's over the counter.
Wow.
So it's very nice to have. One of the main.
I used it actually.
Yeah, that's good. You put a pea amount on your finger, dab it in 5 to 10 spots, and then rub it all in. It's important though, you want to make sure your face is completely dry before you put it on because it can cause some irritation.
Okay.
And the other thing is, you want to start out every other night because it can be irritating to your face. So use it every other night for the first 2 weeks and then use it nightly.
Okay. Now, I know a lot of the times people don't really even think about going to a dermatologist until maybe they're starting to battle some acne or something like that. How often do you suggest someone goes to see a dermatologist?
That's a good question, and it all depends. If you have a rash, acne, or a skin lesion that's bothering you, you should see a dermatologist. The sort of general recommendations is if you have more than 50 moles, if you have a personal or family history of skin cancer, or If you've ever bathed in the sun or used a tanning bed, you should make an appointment to see a dermatologist.
Okay, well, doctor, thank you so much. Unfortunately, we're out of time. Real fast, if someone wants to make an appointment with you, do you have a phone number that you would suggest they call?
They can visit the website, and the phone number should be listed on there.
Perfect.
But we're taking patients, and we're happy to see anyone no matter what their problem is.
Awesome. Well, thank you so much, doctor, again. And again, you guys can watch this on WSAZ.com. Just click on the Moms Everyday tab, and have a great day.